Let's be honest here for a moment. Most people believe that after 70, knee pain is permanent, that once your joints start hurting, that's it. You accept it. You slow down. You sit more. You stop doing the things you love. That is the lie. Here is the truth. Your knees are not finished. They are asking for the right signal. They are waiting for better blood flow, better cellular communication, more lubrication, more internal spark, and almost nobody teaches you how to give them that. By the end of this video, you will know exactly why your knees hurt and how one simple oil used the right way can help bring back comfort, strength, and confidence. You might have noticed this already. You stand up from a chair and it hurts. You go downstairs and it hurts. You wake up in the morning stiff and slow. You avoid long walks. You avoid travel. You avoid stairs and you tell yourself, well, I'm old now. This is normal. No, it is common, but it is not normal. Let me explain in simple terms. Your knee is like a hinge, a beautiful, complex hinge. Inside it, there is cartilage. There is fluid. There are tiny blood vessels. There are nerve endings. When everything is healthy, the hinge moves smoothly. No noise, no pain, no friction. But over time, poor circulation, inflammation, sugar, stress, lack of movement, they dry out the hinge. The fluid becomes thick. The cartilage becomes weak. The nerves become sensitive. So every step feels heavy. Every movement feels risky. And most people make it worse. They stop moving. They rely only on pills. They ignore blood flow. They ignore nourishment. That is like parking a classic car in a garage for years and expecting it to run perfectly. Let me tell you about Mary. Mary is 73. She loved walking in the park. She loved shopping. She loved visiting friends. Then knee pain arrived. Slowly, first in the morning, then on stairs, then all the time. She started sitting more, smiling less, going out less. She said, I feel trapped in my own body. Doctors found no emergency, no surgery needed, just age-related changes. So she felt helpless. One day, she changed her routine, not with expensive treatment, not with injections, with one oil used the right way, with the right habits. After 1 month, she told me, I walk again without fear. That is what I want for you. Before I tell you about the oil, let me give you your first micro win. Go to your kitchen, find your cooking oil. If it is highly refined, clear, smells like nothing, reduce it. Those oils increase inflammation. They dry out joints. They damage blood vessels. Switch more to natural oils when possible. That alone helps your knees. Now let's talk about the star of today. Castor oil. Yes, simple castor oil. Cheap, available, powerful. This oil has been used for generations, not for cooking, for healing. When used on the skin, it penetrates deeply. It improves circulation, reduces swelling, calms nerve, supports tissue repair. It helps your body send healing signals to the joint. But here is the secret. Most people use it wrong. They rub it quickly, once in a while, with no routine. That gives weak results. Here is how Mary used it. At night, before bed, she took 1 teaspoon of castor oil, warmed it slightly in her hands, then massaged her knee slowly. Circular motion, gentle pressure, 5 minutes each knee, not rushing, talking to her body. After that, she covered the knee with a soft cloth and went to sleep. Why night? Because at night, your body repairs, blood flow shifts, inflammation lowers, cells rebuild. The oil works with that process, not against it. Now, here is something few people realize. Oil alone is not enough. It works best when paired with movement. Mary added one habit. Every morning, she did simple knee circles, sitting on a chair, slowly rotating her lower leg, 10 times each side. This pushed fresh blood into the joint, carried nutrients, removed waste. That prepared her knee for the day. And that leads to the next secret. Most knee pain is not only in the knee, it starts in the hips, the calves, the feet, poor alignment. So she also massaged her calves lightly with the same oil. Better flow, less pressure on knees. Now let me pause here. If this feels different from what you usually hear, if you are learning something useful, please like this video. Subscribe to this channel. We share practical health wisdom for real life. Now let's continue. Mary also fixed one big mistake. She stopped sitting for too long. Every 30 minutes, she stood up, walked for 1 minute, even inside the house. That kept joints alive. Still, joints become rusty. Moving joints stay young. Now, let me share a synergy secret. Castor oil plus turmeric. Once a day, Mary took a small pinch of turmeric in warm milk with black pepper. Inside and outside healing. Inside reduces inflammation. Outside improves circulation. Together, they accelerate recovery. That is synergy. Global longevity studies show something interesting. In long-living communities, people stay mobile. They walk daily. They sit on floors. They stretch. Movement is medicine. Harvard Health also talks about joint lubrication. Movement pushes fluid in the cartilage. No movement, no nutrition. Now think of your body like a vintage engine. Your knees are shock absorbers. If they dry out, every bump hurts. You don't throw away the car. You oil it, you tune it, you respect it. Castor oil is your tuning oil. You might think, I'm too old. Mary started at 72. You might think, it's messy. Use a cloth. Wash hands. Simple. You might think, it's expensive. One bottle lasts months. Cheaper than painkiller. Smart substitution. No castor oil, use sesame oil. No turmeric, use ginger tea. Adapt. Don't quit. Here is the full daily rhythm. Morning, knee circles, gentle stretch, light walk. Day, move often. Avoid long sitting. Drink water. Evening, light dinner, no heavy sugar. Night, castor oil, massage. Warm cloth, early sleep. That rhythm healed. In 7 days, less morning stiffness, better flexibility. In 14 days, more confidence in walking, less swelling. In 30 days, many feel stronger knees, better balance, more freedom. But listen carefully. This does not replace medical care. If you have severe pain, if swelling is extreme, if you had injury, if you take strong medicine, always consult your doctor. This routine supports healing. It does not replace treatment. Wisdom is balance. Now, my friend, healthy knees mean independent. You climb stairs, you travel, you pray standing, you play with grandchildren, you live without fear of falling. A body that listens to you again, a joint that supports you again. That is dignity. If you want the complete system for long life and strong joint, watch the next video. The ultimate longevity blueprint. It connects everything. Until then, oil your hinges, move gently, respect your body, and enjoy every step ahead.